Thanks for joining us again on Fertile Ground. We're back in the studio today with Dr. Jodica Ruba, who's going to talk us through the schedule of testing that you can expect during pregnancy. It can feel like a pretty busy schedule sometimes, so we wanted to explain what each test is about and what we can learn about your baby. Welcome back, Dr. Jodi.
Thank you.
I'd love to ask you a bunch of questions about specific screening during pregnancy. So for the beautiful mums-to-be out there, what type of screening can they expect throughout their pregnancy?
So there are some early screening tests that are available to all pregnant ladies should they choose to have them. And one of the most talked about tests is the 10-week blood test, which we call NIPT, or non-invasive prenatal testing. NIPT. It is a screening test for chromosomal problems in babies. So chromosomal problems happen more commonly the older women are, but any chromosomal problem can happen to anyone of any age. And so screening is definitely available to everyone. Unfortunately, it's not government funded, so it is an out-of-pocket cost. And it depends on what brand of NIPT you go with. So there are a lot of different brands out there. So that's something also to discuss when you see your GP or your obstetrician, what the differences are between the brands of testing and whether or not that test may actually give you a false result. So sometimes you get a falsely positive result. Those are usually rare, but it can happen. And what is the yield? So how accurate is that test? That's very important. That, how frequently can it pick up a problem? So the most common chromosomal problem most people are familiar with is Down syndrome. So that's an extra copy of chromosome 21. So most of the NIPT testing will look for extra chromosomes 21. 13 and 18, which are also common extra chromosomal problems, and can actually tell you about the gender of your baby, which is exciting for a lot of people. But also importantly with the gender is missing or additional chromosomes, which can affect the baby. So that information is also available from that testing. And some of the tests can specifically look for other genetic problems, but that tends to come with a lot more cost. And generally speaking, I tend to recommend a specific test that actually goes down to a Melbourne hospital. And so when people come in early pregnancy, they'll often already be aware that NIPT is available. And it depends on the brand of the test as the cost can be roughly anywhere between $450 $600 for that particular test. And a lot of people find it very reassuring that the test is out there and they can get results. And the test actually looks for free placental DNA in the maternal circulation.
Yeah, where does the actual data come from? So is there baby DNA floating around in mum's blood?
There is. So it's actually placental DNA. So 99% of the time, the cells that are present in the baby are the same as the cells in the placenta. So 1% of the time, the cells in the placenta may differ from the cells in the baby, and we call this mosaicism. So mosaicism means that some of the cell lines in the placenta may be abnormal, and that may reflect a problem in the baby or it may not. So that's often where we can run into difficulties interpreting NIPT, and that's why the better lab that does the test may be able to tell the difference between those. But again, realising it's a screening test, it's not a diagnostic test, so that if we get an abnormal result, then we talk about confirming that abnormal result with invasive testing.
Can you help me understand better how you would go through invasive testing?
So basically it's done anytime after 12 weeks. So at 12 weeks of pregnancy, the placenta is grown enough to be able to do what's called chorionic villus sampling, or CVS, where a needle is introduced under ultrasound guidance through the mother's tummy into the placenta, and cells from the placenta are extracted and then analysed. Usually that test, we can get a fast result on a few of those chromosomes, the important 13, 18 and 21, and the gender chromosomes, usually within 48 hours. And the whole of the test with all of the complement of chromosomes usually takes about 2 weeks to come back. Sometimes the placenta is not very accessible through the woman's abdomen, so that we have to wait till about 14 to 15 weeks and do what's called amniocentesis. So amniocentesis is where a needle is introduced, again, under ultrasound guidance, so it's safe, goes through the wall of the uterus and then into the fluid around the baby. In the fluid are the sloughed off skin cells of the baby, and those are cultured to actually get the chromosomes to understand what's happening with the baby.
And that'll give you that'll give you much more concrete information.
That gives us a 99% certainty that the baby is or isn't affected by the condition that we suspect from the NIPT result.
Yeah, so NIPT is something almost everyone gets.
I would say almost everyone thinks about it.
Yep.
And the important thing to know about any screening test is whether or not the couple would take action on the result of that screening test. So there's no point doing a screening test for some couples who would say, look, I would never end a pregnancy based on an abnormal result. So it's important to talk to them about that. Some people just want to know that their baby may have a certain condition that can help them prepare during the pregnancy to have a baby with that particular condition. So there are different reasons why people might want to know about NIPT, and one of the reasons may be that if their baby is affected, they have the choice to then stop the pregnancy if they want to.
Okay. The other common thing you see with women that are pregnant are ultrasound tests or screens. When's the first one? When can you actually hear a baby's heartbeat through an ultrasound?
So you can hear
you
can definitely see a heartbeat from around 6 weeks of pregnancy. So sometimes as early as 5 weeks and 5 days. So I would say most ladies will have at least a dating ultrasound. So early in pregnancy, around 7 or 8 weeks, maybe they have a slightly irregular cycle, so they want to find out exactly how pregnant they are. Maybe they've been through a difficult IVF journey and they just want to see that everything is going well. And after a certain point, blood tests are not very helpful in telling us how the pregnancy is progressing, and it's much better to have an ultrasound to see how the pregnancy is progressing, to see where the baby is, to make sure it's inside the uterus. We know that a very small proportion of pregnancies can be ectopic or outside the uterus, and therefore can be dangerous to a pregnant woman. So it's important to know, how's it going? Is there one baby? Is there two babies?
Oh, yeah, that could be a thing.
And that can happen with IVF as well. So even with a single embryo transfer, there's a tiny chance of having a twin pregnancy. And, of course, then knowing how that pregnancy is progressing. So many women will have a first trimester ultrasound or a dating ultrasound, and then the next big ultrasound usually happens at 12 weeks. So, again, this is an ultrasound that can be used for a couple of different purposes. So the main purpose a 12-week ultrasound was devised was for looking for chromosomal problems. So a lot of people having a 12-week ultrasound may have opted not to have NIPT and instead have this particular screening for chromosomal problems in a baby. So we call this the nuchal translucency ultrasound and combined screening test. So a blood test is taken at the same time as the ultrasound, and the thickness behind the baby's neck, called the nuchal translucency, is measured. And there are a few proteins looked for in the blood of the mother. And these proteins, combined with the thickness behind the baby's neck and the maternal age, can help determine the risk of a baby having Down syndrome or another extra chromosome. And the pickup rate for this test it's quite high, so it's around sort of 90-95%, depending on who was doing the ultrasound. And from that test, you don't get a yes or no result the way you would with NIPT. This test gives you a probability result. 1 in 100, 1 in 1,000, the higher the number, the lower the risk to the baby that the baby is affected by one of these chromosomal problems. The other purpose of the test is actually to check the structures inside the baby and the size of the baby, so they can amazingly see things like structures inside the brain, the structure of the heart, and they can also do assessments for other risks, things like, will this baby be at high risk of developing growth restriction during the pregnancy? Is this mother at high risk of developing preeclampsia? And is this baby at risk of coming early, preterm birth? So in some centres, they're actually able to give us all of that information, which can be very valuable because there are some things we can actually do to try and prevent a woman from getting severe early onset preeclampsia, and surveillance that we can offer to those women who we think might be at risk of their baby not growing very well or coming too early.
And just for my clarification, this 12-week scan is done by a sonographer, not by you or by a
That's
obstetrician.
right. So we usually, those very specialised ultrasounds are done through ultrasound places that are designed usually just for women's ultrasound because it's very highly specialised ultrasound.
Yeah, I've sat in that room a couple of times, and it takes a good 45 minutes to an hour. They go through every little part of that little person. It's really quite amazing.
It's quite amazing. It's really interesting to watch. And yes, the sonographer has to be very patient.
Yeah, there's often some jiggling around, or can you stand up and sit back down again?
Yes, exactly.
Yeah.
So we're at the mercy of the baby.
The 12-week scan, do you need to avoid any areas if you don't want to see anything regards gender?
It is a lot harder to see the gender at 12 weeks.
So you can be you don't have to try to avoid anything for the dads or the mums.
Usually the sonographer's very canny, so they'll tell you, look away at this point. And if it's fairly obvious, it can be very difficult sometimes to see the gender at 12 weeks. Okay. So I think, yes, you're probably less in danger of seeing something at 12 weeks than you are at the 20-week ultrasound.
Speaking of the 20-week ultrasound, what's the difference? Why do we need to come back and do it all again?
So the 20-week ultrasound is designed to have a really good look at the anatomy of the baby, the position of the placenta, and the length of the cervix. So the anatomy of the baby is most ideally seen at around 20 weeks, particularly the heart structures and inside the brain. But it's a very detailed scan that can take up to an hour to do. So again, it's very dependent on the baby's position. So sometimes women do have to go for a walk and come back. And important structures like the spine are visualised to exclude things like defects in the spina bifida. A good look into the brain, a good look at the heart to make sure they can't see any structural problems with the heart. And then they measure all the long bones, they see how the baby's growing, they look for things like cleft lip and palate. It's a very long, detailed ultrasound. Again, they look at the placenta and where the placenta is, and that's important to know to make sure the placenta is not blocking the path of the baby out of the uterus, and that can have implications for the rest of the pregnancy and risks of bleeding for the mother. And the other important thing that all mothers are assessed for is the length of the cervix in the pregnancy at 20 weeks. And that is a very good indicator of the risk of preterm birth. So the shorter the cervix, the increased risk of preterm birth in the pregnancy. So everyone in Australia, it's definitely recommended that they have at least the 20-week ultrasound.
Yeah, that's it's all about data collection, right? Like you want to know as much as you can.
Absolutely, and I think it's also about understanding where that patient should be having their baby as well. So if they see a complex heart problem, that may indicate that the baby's at high risk of other problems or chromosomal problems, so that may trigger other testing. It may trigger more detailed ultrasound, maybe an MRI of the baby to find out more information. So it also may help us understand where that baby may be best delivered. So in a place like Canberra, we don't have things like children's heart surgery that goes on there, but if we discover a baby that may have a significant cardiac problem, then we're able to actually send them to see specialists in Sydney and to plan delivery in Sydney so that the baby, if it needs immediate surgery, can be looked after in one of the big Sydney hospitals.
Absolutely.
So it's important to help us triage patients so that they deliver in the best and safest place.
And regards the scans that we've discussed, when do you look at them? How do you receive them? What's the communication between the sonographer that we mentioned and you?
Yes, so usually as part of the way we receive that information, the sonographer usually works with a radiologist or an obstetrician who actually specialises in ultrasound, and they actually go through those images themselves and write us a report. So we don't look at the images ourselves and write a report. They actually tell us all of the things that we'd previously mentioned in a concise way that we can understand and that we can then convey to the patient. Most of the sonographers are actually amazing at communicating that during the time they're doing the ultrasound. So if they're confident, they'll tell you at the end of the ultrasound, everything was great. Look, I can't see any problems. So women feel very reassured. So I think the better quality ultrasound you have, the more information we get. And so we do tend as obstetricians to gravitate towards ultrasound that's provided by specialised groups so that we can give you the best information.
Of course. And so after that 20-week scan, is there any other major screenings that are happening, or is it just stuff that you're doing between yourself and the soon-to-be mum?
So usually I will do regular ultrasounds myself. I think women love to see their baby, to see their face if we can see the baby, and I generally will check the growth of the baby through the pregnancy. If I have other concerns, we may do a later third trimester growth ultrasound just to understand what's happening. Really depends on the history of that mother as well. If she's had previous problems during a pregnancy, we may up the surveillance of the baby in a more formal way and send her out for more formal ultrasound examinations. And the big screening comes again at usually between 24 weeks and 28 weeks. There is another blood test that women undergo, just checking their iron levels and doing what we call a glucose tolerance test, looking for gestational diabetes. Most people don't enjoy that test, I would say, and that's very justified.
Yeah, the advice my wife received was make sure you pack a muesli bar for the second you're allowed.
Yes, absolutely. So it's a test that's done fasting from midnight, and usually they will do 3 blood tests. So they're done over a period of 2 hours, and just before they take your blood, you have a lovely sugary drink, and they do what's called a fasting blood level, and then 1 hour after the sugary drink, and then 2 hours after the sugary drink. And that basically is a diagnostic test for gestational diabetes. So that's a big screen that goes on, and we are finding a lot of gestational diabetes amongst the Australian population.
Yeah, so it's something you keep an eye on.
Yeah, definitely something to keep an eye on. And if we do diagnose that, then we usually have a really detailed discussion about going to see a diabetes educator, someone who can help you understand how to monitor your blood sugar levels, what the implications of those are, and usually if you need help with controlling your blood sugars and it's not able to be given through a change in your diet or exercise, then a small proportion of ladies will have to start insulin, and that's usually guided by an endocrinologist.
Okay. So there's lots to keep an eye on, but there's also lots of ways to get this information is sort of what I took from this chat.
Absolutely.
Yeah, thanks very much, Dr. G.
You're welcome.